we will be trying to look at PCOS and what it means and what nutrition could do with regards to managing this very common disorder amongst females. We will be covering what is PCOS, how insulin resistance is the major factor in this game, diagnosing and treating PCOS, and since I am a nutritionist, we will be covering how nutrition guidelines can be used to help reduce this problem. Polycystic ovarian syndrome is defined as ovarian dysfunction syndrome and exhibits a combination of heterogeneous symptoms and signs. It is a very common disorder or mishap, or you can say aggrieves a lot of women today. Yes, and almost 10% of females today are known to have this problem, and it is a very common cause of anovulatory infertility. It is a hormonal imbalance and has numerous implications on a person's health and well-being and affects females right from adolescence to after post-menopause. Now you must be wondering, okay, am I also a victim of this disease? So if you have these similar, feelings, yeah, normally, when patients come to me, young girls or even ladies, they say that soon after I've had a high carb meals a lot of rice, potato, bread, and then I feel very sleepy, or then I'll have very enhanced sugar cravings, or whenever I've had high protein like chana or eggs or fish or chicken, I feel very alert, very energetic, or if within 3 to 4 hours of eating you're again feeling tired, or you're constantly asking for carbs like chocolate, sweets, ice creams, a cold drink, a coffee, a tea, or if you are looking at your cholesterol blood reports, you will see a higher level of LDL and triglycerides, then you could be a case for a PCOS syndrome. To put it in a lighter manner, you could be a sister. Yes, if you have these carb cravings, you're forgetful, you're always obsessed with hair removal, because hirsutism is one very common symptom of a PCOD case. Now what are the health risks one is normally seen to associate with PCOD is there is insulin resistance, metabolic syndrome which is signified with higher blood sugar levels, higher triglycerides, a bigger waistline. This is also at risk, people who with PCOS are at risk of diabetes, and of course most PCOS are obese, but you do have the thin people who show PCOD syndrome. The other more risks are endometrial cancer, you've got sleep apnea which could disrupt your sleep, hypertension, mood disorders, heart disease and pregnancy complications. Mostly in our country, you come to know of a PCOD when a woman is married and not able to conceive, or she's got irregular periods, and then that's when the gynec will diagnose you as a PCOD case. But more importantly, I have seen my own patients, they show lot of mood swings. When I am able to evaluate them for a PCOD case, I see that they have mood swings, they are very often depressed, very anxious about their weight, how they look, or the slightest of emotional problems, like not able to go for a movie with the husband or the boyfriend will trigger a binge eating syndrome. She'll want to go and have a chocolate or a cold drink or an ice cream, she'll have bread, butter, jam, sandwiches, and that is the end. So binge eating again will give you more insulin resistance, more mood swings. When it comes to pregnancy and the woman trying to conceive, mostly to marriage, you've seen that women who are obese and then they are showing PCOS syndrome will have a very common history of spontaneous abortion, will have impaired glucose tolerance, there will be gestational diabetes, blood pressure, and the baby born will be small for gestational age. When we see a baby born like 5 pounds, 6 pounds, that is when the mother would be having those health problems. So what is the etiology? It is mostly genetic. Normally you see it in children, where one of the parent is diabetic or has got insulin resistance. And yes, even the environment is one important component to this disease happening more commonly in today's time, because today of late in recent 10 years I see there's a remarkable increase in obesity, irregular meal times, and more you can say more youngsters, youth are attracted to the fast foods which are again high carb and high in trans fats. So, when we are looking at diagnosing a PCOD case, we are looking at higher levels of androgen, the male hormones, and insulin levels again are very high, and obesity which is there, which will further magnify this issue. But 70% of the patients with PCOD are obese, just 30% are supposed to be thin. But even though they are thin, they will have normal blood sugars, yet they will have insulin resistance and hence PCOD. So what is insulin resistance? Insulin resistance is the condition where cells do not adequately respond to insulin. Insulin resistance appears to result from several defects in the relationships among the insulin, its receptor and the genome. It increases with age and obesity, but of course we just spoke about higher the waistline, more the abdominal obesity, more higher the PCO issue. And at puberty and at pregnancy, when the hormones have their highest aggravation in the woman's body, that's when you see the PCOD at its worst. These are two simple diagrams where you see in the first one where the normal cells, you see a proper balance between the glucose, the insulin receptor and the insulin. But in the lower diagram, you will see that yes, the sugar is not being utilized because the insulin is not sensitized enough to use up the glucose for energy purposes. As we spoke about it, that when you have insulin resistance or wasting of insulin, okay, in the woman's body, that's when she will have more enhanced food cravings and will be obese, will gain weight easily, and will also have difficulty in losing weight. So as I said, you could have a thin PCOD, you could have an obese PCOD. How do you diagnose? Yes, there are clinical symptoms, there is hormonal testing and there is ultrasound reports. So when you are looking at the Rotterdam criteria, we are looking at hyperandrogenism, wherein you will see acne, mostly girls with a lot of acne on their face, yes, and leaving scars, excessive hair on the face. When you see male pattern baldness with the top, the crown of the girl, that's why she has thinning of the hair, you will see balding, and that's so commonly seen nowadays. When you are looking at your hormone levels in that particular case, you will see higher levels of testosterone, higher levels of insulin. Then ovulatory dysfunction is like in the history, in the person's medical history, you will see that she will have irregular periods, or they will come too frequently, or they are too heavy, or they are too light, scanty, and an ultrasound will reveal small cysts. See, when I am talking about acanthosis nigricans, the darkening of the neck, you see this dark colored striations. Yeah, you will see it in young girls, obese women, you will see a darkened neck. Then the chin will have a lot of hair like the male. And so you can look at the crown, you will have thinning of the hair. So these are very classical, this is for all to see. Normally you see them even as young as 12-year-olds nowadays are coming to my clinic. 10-year-olds are also, who are like pre-pubertal, before the menarche. I see them with dark neck. And once they start losing even just 5 kilos, supposing I saw this girl, last month, and we happened to make her lose around 5 kilos. She was like almost 90 kilos at age 11. Yeah, so yesterday we saw her. Yes, it's very, very common, very, very common. Since I am a nutritionist, I am looking at so many cases. Now, I cannot be showing that girl's, photo here, that's against privacy norms. But yes, when this girl lost just 5 kilos in a month, it was so easy for her to do it. Yes, we'll talk about diet intervention, and then we saw that, yes, her mother told me that, look doctor, her neck is looking so much cleaner now. And she felt that because she's not having a bath, she's dark. But that darkening was because of insulin resistance. Okay? Now, when you're looking at your lab, blood reports, what you'll see is that there is excess level of fasting insulin levels more than 14. When you are seeing a ratio of less than 4.5 in adults, and in adolescent girls less than 7, the ratio of fasting glucose to insulin comes to less than 4.5. Then again, and also your oral glucose tolerance, when you're giving a person 100 gram sugar post 2 hours, you see the blood sugar level, the sugar rises beyond 140. That's when the person is a PCO and also at risk of diabetes. So we will now focus our talk on nutrition and lifestyle interventions to improve or solve a case of a PCOD. Most importantly, our goal should be to regulate in the young girl, in the young woman, her menstrual cycle should be regular. So that will again help in, a proper weight loss. You correct the metabolic abnormalities, especially the insulin resistance, the hormones. We spoke about the male hormone androgen, that is testosterone. blood sugar levels and cholesterol and blood pressure, because see, blood sugar, cholesterol and hypertension is seen in adult women, post 25. In the young girls, you just see acanthosis nigricans, darkening of the skin. You will see that the girl will say, I'm losing hair. She will have a very enlarged waist, girth, something as high as 95 to 100, which you normally see even in young, you've seen obese men. Yeah, I mean, they are so huge in today's time. Girls and even young boys are so huge. See, acanthosis nigricans, thinning of the hair, a bigger waist, and I've even seen young boys nowadays. And those children, when I see their HbA1c or the glucose tolerance, I'll see sugars on the higher side. They may show a low fasting sugar, but they will show higher post-lunch, sugars. Yeah, and especially when you give them a sugar loading, that's when they show those higher levels. So that's the way you catch these people, at the very start. And you start. I believe that if I educate the child and the parent, on eating the right foods and changing some lifestyle behaviors, then we go a long way in improving their future health. So once again, when you've controlled the hormone imbalance, the child shows better skin, better hair, the hair fall reduces, there's improved fertility and improved overall, well-being. Like the mother of the child is now much more active than before. She doesn't want to sleep, she's studying better, she's focusing better, and I was so happy. Okay, so the benefits, we all know that once you've controlled the diet and the exercise comes in and becomes a regular habit, whether it's a child or a young lady or a young man, yes, we will see a better level of hormones, especially controlling the male hormones in a female body, improving lipid levels. Normally I see that there are higher triglycerides and higher LDL levels in these PCO cases. So when I improve on their diet, their dietary fats, we'll go about those things later on. Then I see that they improve upon the lipid imbalance. Yes, we'll improve on their diabetes risk and improve insulin sensitivity. Normally, a lot of studies the world over and India too, and my own clinic, I've seen that women with PCO are very fond of high energy. Yes, that is high calorie intake, high fat intake food, normally fried foods, farsans, and India is known for its rujan or its interest towards these fatty snacks. We are all attracted, nahi? So now diet and weight loss. See, when you are trying to bring about a weight loss in a patient, or whether it's a girl, boy, man, woman, we look at improving the energy balance. So when we look at a negative energy balance, and that could be reducing your energy intake, increasing your exercise quotient, so by you are going to increase your energy expense. So even if you are bringing about as little as 200 calorie deficit per day, you will see that in a few weeks the person will not gain weight, but he will start losing weight. That's a slow and steady weight loss. See, for example, if I ascertain your energy intake and I find that you are intaking 2500 calories for the day, and if I show you that okay, you can reduce that 200 calories by avoiding that chocolate or that vada, or that bread butter jam, a very simple, a cup of tea with 2 spoons of sugar with bread butter jam, agar utna bhi humne kam kar diya, we bring about 200 calorie deficit. But for a person who's like really, like I spoke about 90 kilos, 100 kilos, 120 kilos, when those cases come in and they are wanting to go and get good results for their pregnancy outcomes, where the gynec send them to us, that's when we have to see that the person under proper supervision will be given a 500 calorie lesser diet plan or 1000 calories. So when we reduce 500 calories per day in the total calorie intake, we see a half kilo weight loss per week. And when we take it as high as a 1000 calorie weight loss, 1000 calorie deficit in the energy intake, we will see a 1 kilo per kg. But mind you, do not do these things stunts on your own, because if the diets are well balanced, you have to look at the adequacy of your nutrition, your proteins, your complex carbs, your micronutrients, yes, and the right way. Because a lot of young girls come to me, okay, I'm doing only fruit diets, I'm doing juice diets, I'm doing orange diets, idli diets. I mean, what are these diets? These are very, very ill-planned, very, very nutrient inadequate diets, and these can have long-term health implications. So even if you reduce 5% of total body weight, suppose the person is like 100 kilos, okay, I'm reducing 5 kilos in a month or even 2 months, I say, okay, you're doing a very good job. Even that by itself will bring about a major change in insulin levels, the hormone imbalance, the lipid imbalance, and you see the changes will show on your skin, your activity. You will be more agile, more alert, more smarter. So One will not, one should be again cautioning against very low fat and high carbohydrate diets, because these are known to worsen insulin resistance. Now, what does low fat and high carb mean? These fruit diets. You have a lot of naturopaths, I don't know whether we can call them naturopaths or whatever, they are promoting only fruit diets. I had this girl, 1 month, 2 month. No fat, low fat, or only fruit diets. See, these diets are very, very sad. They will worsen the person's immunity, insulin resistance, and also it will promote more inflammation. So one must, yes, and very low carb diets. I have seen people, very low carb diets. I've seen very low carb diets in people. People just doing 1 apple a day, and then they're running for 1 hour, gymming for 1 hour, and then even those are known to be very sad, because they will again give you other health risks, like you'll have fatty liver, yes, acidosis, you'll have so many issues. Like this girl whom I saw yesterday, new case, she has gone to some naturopath for 2 months only fruit diets. Now she's got recurrent ear infections, and she's on very high doses of antioxidants. And I saw that classic feeling of thinning of the hair, darkened neck, bigger waistline, and now she's not able to lose weight at all. So then you are creating, yes, she's come to a plateau level. Initially you feel happy, okay, I lost 5 kilos in a week and all that, but that's just not right. One should not go beyond half to 1 kilo under a supervised, trained clinical nutritionist. I mean, that's my caution. Because then it becomes very difficult, to lose weight and then control the hormonal imbalance. So carbohydrates in PCOD, we look at carbohydrates. See, what do carbohydrates mean? You've got simple carbs, you've got complex carbs. Okay, so when you are looking at especially a PCO case, we try and reduce the intake of high GI foods. What are those? All your cold drinks, your hard drinks, your breads, bakeries, your sweets, watermelon, rice, white bread, all those things are high GI food. So you have to curb intake of that. You have to include more of your complex carbs, like your unrefined cereals. Cereals, you have whole wheat atta, you've got brand induced atta nowadays, you've got oats, you've got nachni, jawar, bajra, all these are higher in fiber. You've got brown rice as against polished rice or maida through your bakery foods. Then you can, once again, when you're planning a diet, we look at that I give you 5 to 6 small meals in the day. So then there are no sugar swings. If there are no sugar swings, there are no peaks in your insulin levels. So then you will be more controlled. And you have to eat frequently. One shouldn't have like more than 3 to 4 hours of gap between 2 meals. Now the second macronutrient is the fat. Yes, fat we all know, the butter we eat. Yes, oils that we eat for cooking, and the nuts and the flesh food. See, all your eggs, mutton, chicken also have got invisible fats. Your dals have got invisible fat. Milk has got invisible fat. Yes. So we are looking at least inclusion of 50 grams of both visible and invisible fats. The combination should be right, and one should make sure that you have at least 30% of your total calories come from your fats. Yes. MUFA consumption, that is your mono unsaturated fatty acids coming in from olive and groundnut and your almond, walnut. Yes, all these, your dark green leafy vegetables, chana, black gram, these are bajra. These have all got to be alna. Alna stands for alpha linoleic fatty acid. Yeah. So MUFA, alna, these are going to help us in controlling obesity and insulin resistance. Unsaturated fats coming in from trans fats, your fried foods, your sunflower oils, your safflower oils, yes, your palm oils. Now these are known to increase your infertility risk. We will look at questions towards the end. So we finished with the talk on time. Now high protein diets. Your next macronutrient is the protein. We finished with carbs because Indian diets are mostly 60% carbs. Your what we are looking at with regards to fat was 30%, and we are looking at proteins at least 20%. So proteins, the right proteins at all your 3 to 5 meals, they should be included, and they are known to help you in blunting your insulin, your spikes. It will help you in better insulin resistance, so that your sugar levels are better controlled. So 20-30% of your total calories should come from proteins. Increase the protein included specifically right from breakfast to mid-morning to lunch, evening and dinner times. See, very often when I look at a person's diet recall, and I'm looking at my patients, I see that they are just about eating, khari biscuit or bread with their tea, and that's their breakfast. or it is just an upama or a poha or a sabudana khichdi for a breakfast. Now this is only carb and fat. Where is the protein, boss? So you got to bring in your milk, your paneer, your low fat paneer, your sprouts, eggs could be brought in. You can even have chicken, yes, minced with your roti, why not? You can have mung sprouts, you can have rajma, include some protein with your breakfast. Higher intake of protein improves glucose and insulin responses, yes, as against the glucose load. Now higher protein will also keep you more will give you more satiety, so you won't feel hungry every now and then. So then you will solve that issue of sugar carb cravings. Normally you see now, okay, let's have a meeta, kuch meeta ho jaye, I mean no reason meeta ho jaye, and that's yes. So adequate protein intake is important to protect the lean muscle mass and increase the muscle response to exercise. Now the second important component when I am looking at a person's weight management, especially in the PCO case, is where I will say bring in the exercise regularity. People tell me, okay, I do a lot of housework, I am walking to the office, but that is not part of a regular routine. I would rather say that no, bring in some form of exercise like weight training, cardio, okay, excessive extra movements. Like, okay, if you are climbing up the stairs, if you are walking down for a short, short purchases, small purchases, if you park your car somewhere far away or don't take your car for small marketing, needs, then you are bringing in more activity. And you have high intensity interval training also, which is now, you have these bikes in the gym where you have cycling at very top speed. Spinning, yes. So you've got aerobic, which is your running, jogging, stair climbing, swimming, cycling, resisting all your weights in the gym or by yourself. Even if you wear weights on your ankles and your wrist and you're walking fast, that becomes weight training with cardio, right? So this will enhance insulin signaling and improve your lean muscle mass and hence improve insulin sensitivity and will reduce the metabolic syndrome. Yes, but what's the metabolic syndrome? We discussed earlier. We had said that, okay, an obese person, a bigger waistline, a higher sugar level, a higher insulin level, a very low, sugar to insulin ratio. All these signs, higher triglycerides, are what we call as a metabolic syndrome. So then you will cure that syndrome. Aerobic exercise, very easy, and it is known to help in skeletal muscle mass and helpful in all age groups, both male, females and all body weights. Anybody who starts walking briskly or starts running, nowadays I tell people, okay, just bring in 20 minutes, 5 minutes of walk, 5 minutes jog, 5 minutes march and 5 minutes stair climb. Do it within your flat where you're staying, don't even go far. You don't need a trainer for that, right? And then if you're going to wear weights on your ankles and your wrist, again you're adding that half to 1 to 2 kilo extra weight, and that will bring in more weight training. So little small changes in your lifestyle can do a lot to improve your hormone imbalance. So resistance training also the same thing, it will improve the glycemic control and improve insulin sensitivity. High intensity interval training improves insulin sensitivity. Then this is the new concept, total accumulated activity. You have these Fitbit and these bands which help you record how many steps you walk in the day. Yeah, so they say that you got to become more active in the day. See, today corporate culture, you're sitting for long hours. People go to work as early as 8 and they're working till 10, 11, 12. I've got these bankers, CAs, even doctors who work so late hours. And quite a few doctors, our own medical fraternity is really unhealthy, having bigger waistlines because they're really stressed out, long working hours, no exercise, and then they again fall prey to those high fat, high sugar, low protein fast foods. So exercise again will improve insulin sensitivity, decrease your blood pressure, improve the HDL. See, high density lipoproteins, the good cholesterol, will only increase if you have a good diet with a good cardio. Yes, good cardio input, that's very important. You will burn calories, increase your lean muscle mass, it will help you in stress management and lower your fasting sugar levels. And in young girls who are acne prone and have got irregular periods, if they start running, walking, jogging, swimming, playing for at least an hour a day, they will see a better, clearer skin. Green tea, yeah, it is promoted, yes, and it does help, but green tea, one shouldn't have immediately with the meal, whether it's a green tea, black tea, white tea, milky tea, whatever tea, do not have it within your meal timings, have it 1 hour pre or 1 hour post. But any kind of tea here will be a chelator, will not let your micronutrients be well absorbed, yeah, post meal. So diet and lifestyle changes, we will have to control the calories, include low glycemic index foods. We will have the healthy carbs and protein and fat at all the meals so that there is satiety. Then anti-inflammatory foods, healthy heart or heart healthy diet where you will include, your fresh fruits, your sprouts, your nuts, complex carbs. You'll look at the healthy oils. What are the healthier oils? You'll have, of course, you will have rice bran oil, groundnut oil, sesame still oil, mustard oil, olive oil, canola. Even your butter is good. Even your butter is a good source. Coconut oil also is a good source. But do not have dalda, ghee, fried foods. Safflower and sunflower oil make it 1/3 of your total fat consumption. Today, a lot of India is doing a lot of sunflower and safflower oils. We need to bring in the variety. We need to bring back, yes, or we can keep 2 to 3 oils in the house and buy 1 liter each and then use little. But more importantly, bring down the total oil, fat, butter, ghee consumption to half a kilo per person per month. Today we are as high as 3 to 4 kilos per person per month. If I ask, what is the amount of oil you buy per family, they'll say 15 kilo ka dabba comes and we finish it in 2 months. Family of 4, imagine, consuming 7 to 7.5 kilos of oil per month. That is really ridiculously high, yes? So I would say, okay, from 3 kilos bring it to 1, then bring it to half. So then you can bring in your nuts. You can have your 2% fat milk. You can have some paneer. You can enjoy a more healthier, more varied, more balanced diet. Now supplements, this again I would say should be only be used under supervision of a gynac, an MD or a clinical nutritionist. Yes, we've got inositols, that is myoinositol and D-chiroinositol. Now these two are being used in various supplement forms and they are known to help in reducing a person's insulin resistance, reducing the male hormones and hence improving the person's ovulation and hence fertility. See, more importantly, when a woman becomes obese, especially around the waistline, that's when you see a higher level of the male hormone testosterone. And the LH, progesterone, that balance goes haywire and then that's when the girl will not get, or a woman not get her periods on time, where it can be too scanty, you'll have bulky uterus, you'll see the cysts in the ovaries on an ultrasound. So that's when, if you bring about those very, very much needed, good diet and healthy lifestyle changes, then you see a change. And then in some cases, these supplements are prescribed, but again, warning is to be used by a proper registered medical practitioner and a good clinical nutritionist team. There's one more supplement which is doing round is N-acetylcysteine, yeah, which is an antioxidant and an amino acid and is derived from the amino acid L-cysteine. It's a precursor, yeah, in the body. Human body will convert that to glutathione and that's again a very potent antioxidant and will prevent against radical damage and supports and brings a better immunity in the person and reduces inflammation, heart disease and insulin resistance. Once again, the third very important thing is coenzyme Q10. Here again it is seen to help in ovulation and clinical pregnancy trials. Once again, any woman who is wanting to use these things will have to go to a proper gynac and a clinical nutritionist who can help you. Yes? So, to conclude this short talk, I hope it was relevant. We need to be emphasizing on the use of a healthier diet. Yes, a more balanced diet, more regular meal timings, increasing physical activity and consciously, yes, religiously, everyday inputs towards weight reduction, and that weight reduction with a healthy lifestyle will help you in a proper health management. Thank you.
Thank you.